Maybe you might tell us what it is exactly that you're hoping to achieve with your treatment.
Just to get the top lip a little bit fuller.
Just the top lip a little bit fuller.
Nice and subtle.
Okay, nice and subtle. You don't want anything over the top.
No.
Okay, lovely. So as you can see in side profile here, when I draw or drop a little line from the nose to the chin, Rachel's profile is pretty good in that the bottom lip sits a little bit behind the line and the top lip a little further behind the line, but probably, as Rachel has kind of alluded to, maybe just marginally, very fractionally, a little bit too far. So what we're going to do for her is very subtly enhance the top lip, maybe define the border a little bit better and the cupid's bow here, and maybe just balance with a smaller amount on the bottom lip then. Okay. In the lip, the bulk or the body of the lip should really fall within the width of the nose, so in this region here. So really what you want is a well-defined vermilion border here, a well-defined cupid's bow, and a ratio of somewhere between 1 is to 1.6, and in younger people you can get away with kind of closer to 1 is to 1, but definitely not in older people. And in the bottom lip then you just want to enhance the little cushions or tubercles of the lip here and here. So you have 2 tubercles in the bottom lip here, and 3 in the top lip, 1 here, 1 here, and 1 here. The ones in the bottom being slightly bigger than the ones in the top. So just a little scratch, really superficial injection to start off, just into the tip here, under the vermilion border to make sure we don't cause any problems outside. And just a nice little injection like that. And then just stop before we exit. So you can almost see my needle through the skin here, and that's where you want to be, because the least likely place that the artery is going to be is in the skin or the superficial tissues of the lip. It's much more likely to be in the muscle, and even more likely again to be on the mucosal side of the lip. So in Rachel's case, do a big smile for Rachel. She has a slightly more prominent tooth here on the left, which is responsible for causing a little bit of asymmetry in that the left upper lip looks a little fuller than the left lower lip, and that's because of the underlying dentition. So we're going to just address that by just bringing the right upper lip very, very slightly outwards. So again, this is just really superficial injection, pulling back gently, stopping before we come out, and coming out like so, and then one more just adjacent to it, just to evert the lip ever so slightly. That's just really a fine tuning just for perfecting. Perfect. Lovely. Very superficial in here and out this way. And we're using really tiny volumes of product here. As you can see, beginning of some very early smoker's lines or perioral lines here. So I'm just going to do a little bit of filler in underneath them to give them support to make sure that they don't become ingrained in the skin. So a little scratch. Again, just a really small amount of filler, because they're just beginning to start, and that should take care of that. So blow and kiss again. As you can see, that's softened them already. Okay, now, so we've used 0.5 ml in total. We've done the lips and we've softened the perioral lines around the mouth.